Hi, everyone. This is my syphilis flashcard presentation. So the disease process, syphilis is a sexually transmitted disease caused by the organism Treponema pallidum. There are 4 stages of syphilis: primary, secondary, latent, and tertiary. And each stage presents different signs and symptoms, which we'll get into in a bit. So the pathophysiology, syphilis exists in 4 different stages, like I mentioned, each presenting differently due to the infection at that particular stage. The primary stage, it manifests with a chancre, is how it's pronounced. At the point of contact on the skin, a chancre is a painless and firm nodule. The chancre typically appears about 3 weeks after exposure, and the T. pallidum organism reproduces here and starts its immune response. Many people miss this stage of infection as the chancre can be located internally, like on the cervix, and may be asymptomatic. Chancres heal spontaneously and without treatment, which is what can then lead to the other stages of syphilis. So if left untreated, the organisms move outside of the chancre and into general circulation, and this begins a secondary stage of the disease, which manifests as a maculopapular rash, and it can typically be found on the palate, palms of the hands, and soles of the feet, as well as mucus patches can be identified on the tongue at this stage. And then the systemic response manifests as like cold and flu symptoms, so low-grade fever, malaise, sore throat, lack of appetite, and then an inflamed sore mouth. So that's kind of related to that rash. And like the chancre, the lesions at this stage can resolve spontaneously, which then leads into the next 2 stages if left untreated. So the latent stage may see a recurrence of the aforementioned lesions, but is generally asymptomatic, and the disease can still be detected in the blood despite lack of physical symptomology. Tertiary syphilis develops if the syphilis remains untreated, and gamma lesions can develop. So these are lesions that can develop anywhere, but mostly affect the cardiovascular system, but can also affect brain, nerves, eyes, blood vessels, liver, bones, and joints. The biggest risk factor, obviously, for syphilis includes having unprotected sex, and risk increases when having unprotected sex with multiple partners. And I really went into many of the signs and symptoms already, but I'm just going to repeat it. So it really depends on the stage. Like I mentioned, primary syphilis manifests with the previously mentioned chancre or nodule at point of contact. Secondary syphilis manifests with the rash that I mentioned, the mucus patches on the mouth and tongue, and then the systemic response. Latent syphilis can manifest as swelling in the lymph nodes. And finally, tertiary syphilis, which is obviously the most aggressive type as it's gone untreated. It manifests as necrotic and fibrotic lesions. So those are those gamma lesions that I mentioned in various parts of the body. And so depending on which part of the body it affects, it can result in dementia, blindness, or motor deficits. Apparently my dog wants to get in on the action. And hang on one. So like I was saying, the depending on which part of the body the gamma affects, it can result in dementia, blindness, or motor deficits. These were that palmar rash that I was mentioning, as well as the mucus patches on the tongue. And there are 2 types of serologic testing for syphilis: treponemal tests and treponemal specific tests. They should be used in conjunction due to the high rate of false positives among non-treponemal tests. And then both tests involve blood samples from the patient. And then clinical specimens can be collected from the patient and identified through microscopy. And yeah, that's my presentation on syphilis. I hope you all enjoyed it.